Hello, everyone. Dr. Jack Wolfson, cardiologist, natural heart doctor. And I want to introduce you to one of the newest members of our team at Natural Heart Doctor. This is Dr. Keith Smigiel. Keith, welcome.
Thank you.
All right, so listen, I want to dive right into it because Keith is going to tell us some of his backstory. Again, he's a chiropractor by traditional training, and then he got his degree as a nurse practitioner as well to be able to offer even more on top of chiropractic care to people. And I guess, Keith, when I think about you, I think about someone who truly is one of these longevity anti-aging specialists, and we'll talk about some of that too. But I do know that you love to help people with pain. And that, of course, is fantastic. So many people suffer from chronic pain, and pharmaceuticals are not the answer. We can do some fantastic things with really natural treatment remedies. So again, thank you for being on. Let's start with this. Kind of
Sure.
let's give us the short version on how you got into chiropractic, and then what you went on your training as a nurse practitioner.
So I was fortunate and unfortunate at the age of 16 having a severe neck injury that put me in the hospital for 2 weeks. I wasn't getting better. I was under traction. I was giving a bunch of painkillers, anti-inflammatories, and I just wasn't getting better. And long story short, a chiropractor got me better when I was 16. Got me out of the hospital, got me back out on the field playing football when I was a young man trying to make my way through high school, and I had to walk around with a neck brace for a while, but the chiropractor got me out of that, and he got me better. So that's kind of how I started my journey with chiropractic.
So that was many years ago. I mean, you
Yeah.
are you and I are the same age. We're both 53, and we've known each other for many, many, many years, which I think is fantastic. Which is why so excited to have you with us at Natural Heart Doctor, where we prevent, treat, and reverse cardiovascular disease naturally. So then from there, you help. Again, I've been adjusted by you, many, many, many times, and under your care for a long time. And then you go on to get your nurse practitioner certification. So what was your thought process behind that?
2012, chiropractor seeing 150, 180 patients a week. I blew out L4, L5 disc. And I was hurt. I was really hurt. I was in bed for 3 days, couldn't move, couldn't get out of bed, couldn't practice, couldn't do anything. I had young kids, and a friend of mine was doing regenerative therapies, and I spoke to him, and he talked to me about these injections that he was doing. I'm like, I don't want any injections. I'm a natural healthcare practitioner. I don't want anything, foreign in my body. And he basically explained to me what some of these substances or solutions are that could help regenerate tissue. And that's what he did. And basically a few days later, I was back in practice, back taking care of my family. And I was really amazed by the whole process. And I was reflecting back when I was 16, like what got me into chiropractic was, it was my life experience. I had a neck injury, I was hurt, and I decided to become a chiropractor. And then I just kind of, for a few weeks, I decided, well, this is amazing. This is something that I want to learn how to do. I want to be able to practice it, on my patients. And how do I do this? So I went back to school for 5 years and got my nurse practitioner degrees. And while I was in school for those 5 years, I did run my chiropractic office, but I also attended all these regenerative seminars. I would go on top of school. I would go and learn and shadow these MDs that were kind of getting out of the traditional model of medical healthcare, just like what you did, Jack. And they would put me under their wing, and I would just spend, hundreds or even thousands of hours learning how to do these procedures under specific technology guidance, which is ultrasound guided injections into the damaged tissue. So we can really focus where the problems are, and then create a protocol that we can get this patient better, out of pain and functioning. You're back to 100% without any drugs or surgery.
Yeah, for the almost 20 years that I've known you, it always surprised me over the years that you've gone through so much training. It's like every time I talk to you, you were either coming from a course or going to a course or some other program, and then 5 years of training to become a nurse practitioner to do the stuff you're doing. I think is really just fantastic because in your career you've seen so many people with pain-related issues, and so many people are suffering from pain. And that's often the first sign of cardiovascular disease, is that someone who has pain, and the pain in the knee, the hip, the neck, wherever it may be, not necessarily cardiac pain, but just having pain in general. Pain means inflammation. That's all linked to cardiovascular disease. People who are in chronic pain have double the risk of hypertension. You can help us understand why. So, as you know, as you look at kind of pain, what kind of pain are we talking about? And then tell us about some of your strategies to relieve people from that pain.
So being a chiropractor, of course, I was focusing on spine pain. That's what I was dealing with. So especially the lumbar spine, 80% of the population sometime in their life will have lumbar low back pain. And a lot of these patients, they're misguided through traditional models of healthcare. They're usually giving painkillers, anti-inflammatories, but it doesn't really address the problem. It doesn't address why they're having pain. So spine pain is kind of where I start. It's my favorite area to treat because I'm very sensitive to it. I understand what patients are going through, and I really know how to target and window in on pain generators. Pain generators are typically, disc issues, joint issues, facet issues, ligament, tendon issues, and sometimes a combination of all these, even nerves that are superficially around your body, these sensory nerves, they can contribute to deep pain generators that can mimic some of these more kind of catastrophic disc injuries. Yes, the disc injury could be creating pain, but you can also have some peripheral nerve sensory pain that can be dealt with minimally invasive procedures and create lifelong changes for that patient.
So tell us about some of these, kind of like how you do that assessment, and then what kind of techniques are you using? How does that whole process look? And I know we're both in agreement on this, that the foundation is always eat well, live well, think well, and then
Absolutely.
we can even do test, don't guess. We can try some evidence-based supplements. And then simultaneously using what I would say are kind of these biohacking strategies. Those are maybe my words, not necessarily yours, as how you would do it, but again, tell us about kind of and walk us through that process. How you assess somebody and then decide how they're a candidate, and then what does that process look like specifically. Let's talk about some of these pain syndromes.
Okay, so we could talk about low back. It's pretty common. Knee is very common also, but let's go back to the low back. So patients that I typically see have been through a lot of providers. They've been chasing low back pain probably for many years. So I usually start off with, a consultation, finding out what kind of treatments they've had, how much pain are they in? Do they have any techniques to get themselves out of pain naturally? Or are they just using medications, using a combination of these things? And then I'll go into a biomechanical assessment. So it's basically, I'm just testing function. Are they able to have forward flexion? Are they able to have rotation? Are they able to pick up their child? Are they able to brush their teeth? Are they able to bathe themselves? So it depends on the severity of how much pain the patient's in. And then I further delve into their examination by doing some functional assessments. Is their gait off? Is their biomechanics off? Have they been in pain for 5 years where they have muscle atrophy and now their knee is starting to hurt because of their chronic low back pain? So it's kind of working its way down the chain. So it really depends on the patient. So if someone's having, a disc herniation and they're having, level 2, level 3 pain, it's different than someone that's had, chronic pain for 3 or 4 years and they're, 7, 8 pain and they don't want to get a surgery, or they may have had surgery. And then they're just really failing at life because of this debilitating pain that they're experiencing. So after my assessment, I would conclude, where are the pain drivers? Okay, we have a nerve that's being impinged. We have a disc that's disorganized or herniated or bulged. We also have arthritis around the spine. So how do I want to address this? We can identify what are primary pain drivers by doing some what I call some treatment, also some testing with these injection procedures. So I can use it as therapeutic and as diagnostic. So if we get a win on a procedure, then I know, wow, this is probably 60 to 70% of the patient's pain. It's from this little sensory nerve that they have in their back that's being entrapped in their fascial tissue because of their gait has been off for so long, or they may have had trauma in that area, or maybe post-surgical. Maybe the surgeon cut that nerve and the nerve scarred over. So we can start with those types of procedures, and then we can move on into further, more richer procedures, like introducing some sort of growth factor, and these growth factors can be donated from patients from amniotic fluid. It could be from stem cells, these types of things. And not every patient needs that. And sometimes we can use something called PRP, platelet-rich plasma, where we harvest blood from a patient and we concentrate down the platelets that have growth factors similar to stem cells, but we're utilizing them from the patient. So they're less expensive. They are very effective. They've been around for a long time, and they do help regenerate tissue. So it may be one of these procedures that we do, a nerve injection or a facet injection, or it may be a combination of maybe all three of these things, nerve, facet, and maybe like a ligamentous or a tendon injection that can really get this patient better. And on top of that, after the patient has received these procedures, we really need to delve into some like functional rehab, where we do specific rehab protocols. And I wrote a book. The reason why I wrote this book, a doctor's journey through low back pain, it's because of the rehab. Wasn't because of these regenerative injections. It's about these functional assessments and doing the proper functional biomechanical rehab to restore function to their natural gait, how they move, how they bend, so they're not irritating these tissues and starting all over again, where they're destroying the tissues that we've just helped regenerate.
Yeah, that makes perfect sense, right? Because if you just look at this approach and say, okay, well, this is a strategy to take care of the pain very quickly, but ultimately, if you're not addressing that primary cause, there is certainly the potential for a lot of these people to relapse. And I know sometimes the therapies that you provide, they are permanent, but clearly the results would be better if you combine that with some kind of functional rehab, correct?
Absolutely. And also, your functional medicine blood panels absolutely give us a tremendous amount of information. And with your products that you offer and supplements to help reduce inflammation, restore function, all these things play a role. So it's multiple therapies that get these patients better. And it's not that it takes years. It actually doesn't take long at all. So if we can address all these issues in a concentration, we can get chronic pain patients better rapidly, especially if their patient is highly motivated and involved with their healing experience.
So we're talking about back pain
Yeah,
anywhere along the spine. We're talking about shoulders. We're talking about hips. We're talking about knees. Where
yeah.
else?
So knee pain is very common too. I do a lot of knee procedures. Patients typically come in and say, "Oh, I have a meniscal tear." Okay, wow. Is that what's driving your pain? Maybe, maybe not. Maybe because that meniscus has been damaged and your gait has been off for so long that some of these nerves around your knee and the ligaments and tendons have all gotten sloppy or loose. So we can use some regenerative procedures to help stabilize those ligaments that stabilize your knee. Start hydrodissection some of these nerves that are around your knee that could be causing a lot of these inflammatory processes that when you have these inflammatory signals continually happening, the joint degenerates more, it becomes catabolic. It's a very toxic, like acidic environment where inflammation is, and it's in a knee joint specifically because it's kind of compartmentalized into that knee joint. And now they're injecting steroids or anti-inflammatories, which even accelerate the degenerative process. That's what the literature is showing. So I don't use those. I don't use those medications in my practice. We use regenerative therapies that help stimulate new tissue growth, slow down inflammation, and actually slow down aging. Because when you have inflammation, they call it inflammaging now. When you're inflamed, you're aging, you're producing more senescent cells, your body's just breaking down. So we need to slow down that process.
So is there anyone who is not a candidate for these procedures? Like, what is the risk of any of these? And then is anyone who's not a candidate, obviously from a cardiology standpoint, I mean, certainly if they're cardiac unstable, but we're not really talking about that. If someone's on a pharmaceutical anticoagulant, I assume there's concerns, but anybody else kind of, what are the risks and who would not be a candidate for this?
So in a proliferation therapy where we're trying to signal new tissue growth, anybody with active cancer diagnosis that's being actively treated, really, we have to really think about the procedures that we could do. There are some procedures we can do, but not any type of proliferation therapy such as a PRP or a stem cell or an exosome therapy, because we don't want to stimulate more, potential cancer cells. Even though now they're using exosomes to treat cancer, I just will not accept those patients at the time unless their oncologist will give them a release, say, hey, listen, this is okay to do. Anticoagulants are fine. Usually we have them stop it for that day. And again, we're not opening up the patient. We're using very small needles. We're using ultrasound. So everything is done very specifically. And, I've never had a problem with patients that have been on blood thinners. And I haven't even had patients that have had active cancer that have gotten released from their oncologist that I have treated and have no ill effects.
Excellent. And all these procedures you're doing over here at Natural Heart Doctor, we got all the
Yeah.
capability, and you're here in the office. What a lot of talk these days about EBU. Why don't you tell us what EBU is and what are the benefits?
So EBO, extracorporeal blood oxygen therapy, basically it's a high dose oxygen treatment. It's a full body ozone treatment where we take your blood from one arm and we put it through a machine that super oxygenates it, oxygenates your blood, filters your blood, and then it passes through UVI light. Ozone and UVI light have very similar properties. They help stimulate mitochondrial function. They help kill off bacteria, viruses, parasites. They crosses the blood-brain barrier where we can superoxygenate your brain. It reduces inflammation. And then that nice clean blood that's been oxygenated, filtered, it goes back into your other arm where it's nice and clean. You can see the difference in color, how bright it is. And basically patients typically don't feel much after the first treatment. It's usually the second treatment if we're treating something specifically, but a lot of my anti-aging patients come in once a quarter for this extracorporeal blood oxygen, or it's called ozone dialysis is another name because we use a dialysis peristaltic pump to administer the treatment. And a lot of these kind of more affluent anti-aging patients, they will do a bolus or an infusion of exosomes after this because that'll target the inflammatory tissues and bring the growth factors there to help signal tissue healing and anti-inflammation.
So anyone who's interested in anti-aging, which is pretty much everybody these days, I go to the conference in Las Vegas every year. Ironically, it's in Las Vegas, which is pro-aging, but the anti-aging conference, the American Academy of Anti-Aging. I mean, there's 10,000 physicians, healthcare practitioners that go to that event every year. So if someone's just interested in pure anti-aging, well, then they would be a candidate for this, like you said, potentially on a quarterly basis. And of course, people would meet with you to discuss what the options are. But what about for cardiovascular people? Without kind of naming specifics about, hey, EBU does this, this, and this, to reverse any disease process, but kind of like how potentially would EBU help the people with cardiovascular disease or brain-based diseases, for example?
Right. So first of all, we're administering high dose ozone, which is gonna superoxygenate all the tissues of your body, especially your heart and your brain. So it's going to cross the blood-brain barrier. It's going to kill off any type of inflammatory processes that are going on in your body due to either, physical stress, emotional stress, or even cardiovascular stress. So we want to slow down that inflammation that's kind of circulating around your body. And what the ozone does is it stimulates your blood cells to absorb more oxygen, which could help with tissue regeneration and proliferation. That's the idea behind it. And the best thing about this EBO system is we're not really putting much into your body. It's medical grade gas and a filter and some UVI light. So we're not putting any chemicals into your body. We're basically just stimulating your intercellular activity to respond better. So we're not trying to, trick out the body. We're just trying to make your cells work and function better. That's how I look at it. Is if everybody in the world can get EBO once a quarter, I think the world would be a healthier place.
All right. So who maybe walk us through kind of the procedure, like how kind of what's the setup? How long does it take? Is there a recovery process along with it?
So typically when a patient's coming in for EBO, we have them come in and they have a protein meal in the morning, just so to kind of keep especially if they never had high dose ozone before. You can get something called a Hertzheimer reaction. Typically with this machine that I haven't seen it much. I've seen it on 2 patients out of about 120 that I've treated. And these patients are usually pretty sick, more, the Lyme patients that, they're really sensitive. So they would come in. I would set up 2 IV lines, one on each arm. Once the machine is set up, the machine runs for 55 minutes. After that, sometimes I give the patient another IV of maybe some B vitamins or methylene blue, just depending on the patient or what their goals are. And then we disconnect the machine and they go home and they're fine. They can go to the gym. They could do whatever they want. They just, they have 2 little bandages on, just like a typical IV, but those heal up pretty quickly. And it's not once the machine's set up, everything runs smooth. But the first part of the process, getting the 2 IV lines set, because most people have never had 2 IVs at one time, that's the most challenging part. And once that's all done, the machine's very smooth. It's very relaxing, and the patients typically feel pretty good afterwards.
Well, I will say this: I've had IV therapy from you before, and you're fantastic at getting access to the vein, which obviously causes a lot of people a lot of consternation. And we've got Jose and Ashley and other
Oh
doctors in
yeah.
our office, and everybody seems super skilled at that. I mean, you never know the individual person,
Yeah.
but in general, we got some great people who are setting up lines in our office. Okay, so we've talked about pain management. We've talked about EBU. Let's dive into sexual health. Kind of how do you address these people who may be struggling with libido issues, male and female, erectile dysfunction issues, male and even female, as one would get into that. Maybe people kind of failure to achieve orgasm, kind of like, because that's clearly, as when you and I are in this in the anti-aging space, and this is a concern
Right.
of people, right? I mean, yes, they want the 100-year hearts and they want their brain, but they want that intimacy. And we know from the literature that people who do maintain that sexual intimacy, they live longer and they live better. So us helping them achieve that, I think, is beneficial on many different fronts. So kind of dive into kind of where you come in that whole area of sexual health.
Yeah. So when you think of sexual health, you always think about male, but sexual health is male and female. But let's just talk about the male aspect right now. So you don't have to have complete ED to not have you can have functional issues or performance issues where you may not able to get in a full erection, or your erection may not last. You may have loss of sensation, and we can help all these issues using something called a P shot, which I've been trained by Dr. Runnels. I've done hundreds of these, and basically P shot sounds horrible, but it's platelet rich plasma. We inject it into the sponge like tissue of the penis to help regenerate not only that sponge like tissue, but also the nerves, the blood vessels. And once those start regenerating, we use something called acoustic shockwave therapy, which help break up some of the small occlusions that are in these small vessels of the penis. So a combination of those 2 procedures can really help with like the physiological effects of getting an erection. Of course, there are some emotional components. I typically don't deal with those. My wife does, because she's a counselor. She's in mental health, works at the Meadows. But there's many procedures that we can do, including some libido enhancing peptides that I've used on quite a few patients. And peptides, there's all types of peptides, but this one specifically helps kind of put you in the mood. So a combination of peptide therapy, maybe some hormone therapy, but typically, with your assessments, I look at your blood work and your conclusion of, what's going on with their hormone levels. I may review that too. If their hormones are quite low, we can do some things naturally to help stimulate their natural production of hormones. So a combination of those, looking at the labs, finding out how long they've been having sexual performance issues, You know, these things all play a role. But a typical scenario of someone that is having more of a performance issues and not complete ED would be maybe one P shot and maybe 4 or 5 sessions of acoustic shockwave and maybe like a little peptide injection that they do at home.
Yeah, and the peptide, I mean, that's FDA approved for women, right? That's that product. I believe that the brand name is called Vilisa, and that's the peptide therapy. So it's FDA approved for women in that category, and we've seen success with that in women. And what we found is that, kind of like, libido tends to be from a mismatch, right? So it's like when the male wants as high libido and the female has low libido, or the reverse, the male is low and the female is high. That's where the issues arise. But for
Right.
people with kind of like this libido mismatch, then that's definitely an issue that we can help these people in. And yeah, the foundation again is eat well, live well, think well. But to the point, these therapies, there really appears to be no downside and tremendous upside. What about things tadalafil, sildenafil, Viagra? Where's that coming into the whole process, or and where is it in your toolbox?
So typically the patients are already tried those or maybe utilizing those. I tell them to continue utilizing those. And basically, if we're going to do a P shot, I recommend that they continue using those and utilize a penis pump. Sounds like from what is that movie? Austin Powers.
Austin Powers.
Yeah. So the penis pump helps, open up those blood vessels that, have kind of been dormant for a while. So we use this mechanical penis pump and you use the either the Viagra, Cialis along with it because we want the penis to get fully erect, stay erect, and the penis pump can assist with that for the first couple of weeks until the natural blood flow is restored and they can perform without using those medications.
So you're talking about a lot of people with kind of extreme erectile issues, but I know that your support of those people really runs the full gamut from people who are 55 and otherwise healthy and they want to perform like they were 18 again, to people obviously that I encounter a lot with severe
Yeah.
cardiovascular disease, circulation issues, diabetes, where it is more of that really physiological, nature where, yeah, there's scar tissue in the blood vessels, the penis and whatnot, and how one could enhance those. And then as far as the female is concerned, because I've not been a huge proponent of female hormone replacement therapy. I mean, you can give me your take on that and what you think. And a lot of people, of course, a lot of medical doctors, reach for it as first line, like, oh, well, you're perimenopausal, so boom, let's put you on the stuff. But do you have an opinion one way or the other?
Yeah, I do. So if we've done all the functional medicine, the assessments, patient's still suffering, especially perimenopause, and they're just not sleeping, not engaging. I do recommend some hormone replacement therapy because their life has been really challenged because typically it's a lack of sleep. They're not able to rest. They're just very moody and sensitive. They could be working, they could be raising, a family. So in those situations, yeah, we could try some hormone replacement therapy. But typically, I like to exhaust all the other, functional medicine protocols, including, are they exercise and they eat well. Uh, so, and typically the patients that I'm seeing that kind of already in that space, they're already kind of there. Of course, they could be doing better. So I would recommend some hormone replacement therapy in those situations. But there's something also called the O shot for women, where it's called the female orgasm shot, similar to the P shot, because the female clitoris is very similar structure as the male penis, of the male penis erectile tissue. So we can do some procedures to assist with not only the female orgasm but sensation and more importantly incontinence. Women are, after childbirth, they usually have some incontinent issues, and the O shot. That's why I like using the O shot mostly is to help women with that because that's an issue because then it leads to UTIs. They can just have some other issues develop from just chronic uh, leakage in their underwear, and they're developing bacteria and so forth. So that procedure really helps with that.
All right. Anything else that you're currently doing that we need to discuss? And then also, What does the future of anti-aging hold over the next 5 to 10 years?
Well, there's a lot of procedures that I do. The main procedure I do are these perineural nerve injections where we use dextrose, which is a form of sugar, to help stop these nerves from firing off a pain signal. And it's one of these pain signals that really doesn't serve a purpose. It's not like, you have a torn labrum in your shoulder and it's telling you not to use your shoulder. When you have these sequestered nerves that are entrapped in your fascial tissue, they give off these pain chemicals, and the dextrose counterreacts that and stops that pain receptor from firing. And more importantly, the nerve will shrink down back to normal size. So now when the nerve is passing through like a little hole in your tissue, like in your fascial tissue, it can actually move and slide in and out of that foramen, or that hole in that fascial tissue, because when the nerve was swollen, it was getting anchored there, causing more pain. So I think that's it's my least invasive procedure. It doesn't cost a lot, but it's extremely effective. And I have a lot of training on these peripheral nerve hydrodissection procedures. As far as the future of anti-aging, the FDA is kind of sequestering a lot of it. They're giving us problems. They just pulled off, I don't know, 50 or 60 peptides that I've been helping patients, allowing them to, to heal by using these peptides, which are, they're still a prescriptive medication, but they're amino acids, and there's typically no side effects, but they do help patients a lot. So the FDA kind of threw those out on us. Some of them are still available, like the older generation ones. As far as like traveling to like Panama or South America or Mexico to get some of these regenerative procedures, I don't think it's necessary. That they are available in the US. The FDA does not like it. We can't make any claims about, any of these autologous or donated growth factors that we utilize. So the FDA, that's where you get into trouble, is like say, oh, we're going to fix all these problems with these growth factors. So I'm not really, I know in Japan, Germany, stem cell therapy is just growing and growing, like especially in Japan. There's a lot of research facilities over there. And there's a podcast called the Stem Cell Podcast. If you listen to that, they're growing organs in labs now, not necessarily full. They can grow livers and pancreas, but nothing cardiac yet. But I think that's here in the very near future, because they're trying to create these 3D printers to print organs out of stem cells, and they're starting to do that. So right now, there's plenty of technology available for patients that are suffering. We can help a lot of patients. We can help slow down their aging process. But I think more importantly, adding years, life to the patient's years. When they're these older generation patients, yeah, they're living longer, but the quality of life is horrific. I mean, they're usually type 2 diabetic. They're having cardiovascular issues. They're having joint issues, and they're not functioning well. We're keeping them alive, but they're not really engaging with life. So that's my goal, is to kind of prevent those things from happening, as I age, as you age, as my patients age, is to, slow down that degenerative process, allow that 100-year heart to really, do what it's supposed to do. Is when you're 100 years old, you should be able to function, do your enjoyable activities, have fun with your family. And that's my goal. So I think the future is bright for our regenerative field, but we're just challenged by the FDA right now.
Yeah, survive, not just thrive, not just survive. And imagine that the FDA is trying to control the whole process again. Pharmaceutical companies who bought and sold the FDA many times over, they're the ones who control the situation. I'm sure they'll want it all under the pharmaceutical companies, not some of these peptide pharmacies, that are doing this, the small mom and pops.
Right.
So I think it also is that, listen, let's hope for the future. We can also communicate, to our, representatives when we're looking for these therapies and talking to our people. Hey, listen, the FDA is doing this. Let's try and do something about it from a political standpoint. And ultimately, it just brings out the point of, hey, listen, get these things done now while they are still legal, because you never know what's going to be available tomorrow. And, Dr. Smigiel can get you out of pain now and may not be allowed to do some of these things in the future. Well, again, it behooves you to do this as soon as possible, for sure. So great information, Dr. Keith Smigiel. So when people want to find you, Dr. Smigiel, again, you're at Natural Heart Doctor. People can just come to the website. The phone number's on there. They can call. They can find out your information on the website, all the procedures that you're doing. And then you offer these free consultation calls to make sure that everybody's a right fit. They're right for you. You're right for them. And then get people back on track.
Yeah, on your website, there is a link to schedule a 20-minute free consultation. I guess you can post that link too.
Yeah, for sure, for sure. Excellent. All right, Dr. Keith Smigiel. I'm Dr. Jack Wolfson, natural heart doctor, home of your 100-year heart and also your 100-year body, with your brain and your body intact. It's all about thriving, not just surviving. See you next time.
Great. Thank you.
That's a wrap.
All right, man.